Good evening, everyone, and a very warm welcome to all the viewers who are joining us today on Premom Health India. I'm delighted to have you all here for a meaningful and informative session focused on women's health and fertility awareness. PCOS is one of the most common hormonal conditions that affects an estimated 1 in 5 women of reproductive age in India. Irregular cycles, weight struggles, fertility challenges, skin issues, mood swings, etc. And yet, for decades, it has been misunderstood, misdiagnosed, and reduced to a reproductive problem. Today, we are having a conversation that is long overdue because the way we name a condition shapes the way we treat it. And something significant has just changed. We'll get to that in a moment. At Premom, we believe every woman deserves access to the best clinical expertise, no matter where she lives in India. Technology is now making that possible, and today is a perfect example of that by helping us to connect with leading experts from across the country while sitting at home. Through Premom Health India, we aim to bring the right knowledge and expert insights directly to every woman who needs it. Joining us today is a phenomenal expert in women's health, fertility, and reproductive medicine, Dr. Laxmi Sangolli. Dr. Laxmi is an OB-GYN, a consultant IVF specialist, and a laparoscopic surgeon with over 12 years of clinical experience. She holds a fellowship in reproductive medicine and currently serves as an associate professor at Shri B.M. Patil Medical College. She is also a widely published researcher with 10 international publications and an active member of the Federation of Obstetric and Gynecological Societies of India. Dr. Lakshmi, a very warm welcome to the Premom podcast.
Thank you. Thank you so much, Judith. It is truly a privilege to be a part of Premom Healthcare India, which is an association. It's an association which focuses mainly on getting the woman to know their real struggle with their own body. So this Premom is focusing on genuinity and solving the problems of the everyday every woman in India. And being a clinical practitioner for 13 years, I've seen a lot of patients with PCOS, or now newly named as PMOS.
Okay, Dr. Lakshmi, let's get straight into the news that brought us here today. PCOS, polycystic ovary syndrome, is now officially renamed as PMOS, that is polyendocrine metabolic ovarian syndrome. This is a landmark global consensus decision. I want to know, what is your take on this and what does it really mean for women? PCOS to PMOS. Yes, doctor.
Okay. So actually, this PCOS is a well-known problem. It is there existing in majority of women of all over the world.
Yes.
So the thing is, only the name has been rectified, because the earlier name, the PCOS, would not justify its condition. The major problem with the woman was, it is not only the disease did not exist only in the ovary. It existed in overall body. The endocrine problem. It is named as polyendocrine because multiple hormones are involved, and polyendocrine, and it is a metabolic syndrome. Metabolic is, it involves all the organs of the body, not only ovary. So ovary is just a part of it, and it is syndrome involves multiple organs. So this is the renaming is mainly the condition, and the disease remains the same. It is being renamed so that everybody should understand. It is not that only women and men should not blame on the woman that you have PCOS, so you have not conceived. It should not happen like that.
Yes.
So they should know that it is polyendocrine, it is metabolic, and ovary is a part of it. And it is a syndrome which involves all the organs of the body. Hence, it is just the renaming of the old existing disease. It's polyendocrine. So endocrine organs, like, see, there are multiple hormones in the body which play multiple roles in many parts of the body. Like, firstly, we speak about FSH and LH. FSH is follicle stimulating hormone, and LH is luteinizing hormone. In a regular menstrual cycle, first half of the cycle, the FSH is dominating, and second half of the cycle, LH is dominating. PCOS patients, this hormone ratio is altered. So there is LH dominance. FSH is not dominant. LH is dominant. LH causes increase in androgen levels. That is, androgen levels means testosterone is high. So testosterone is high. It causes androgenic features in the patient, like hirsutism, that is excessive body hair growth, acne. So these are the features of hyperandrogenism. Then comes the irregular cycles. Irregular cycles is also because of increased LH. So the ovulation is not as it occurs for every woman. It is not a regular 28-day cycle with ovulation on 14th day. So PCOS has the features of irregular cycles, acne, hirsutism, and obesity. So all these features plus polyendocrine features like insulin resistance and obesity. The importance of insulin resistance and metabolic syndrome has been added, and polyendocrine features has been highlighted in this renaming. In this renaming, they want to show you that the main cause is not ovary, the main cause is endocrine. So I told you about FSH, LH, androgen, that is testosterone. These all are playing multiple roles. Insulin resistance. Insulin resistance is also a major part, which is not affecting only the reproductive woman. This PCOS is not only for the reproductive woman. It also affects the adolescent ladies as well as perimenopausal women.
Okay.
So it is polyendocrine problem. So it causes cardiovascular diseases, diabetes. So we have to evaluate for all the endocrine problems, thyroid problems. So the patients feel fatigue, depression, they have mood swings. These all are the master gland for this is endocrine. So they have shifted the name from ovary to endocrine. That is the metabolic syndrome. So that is what we wanted to highlight by renaming it.
Okay, so you're saying that the disease is almost the same, but because they are renaming it, we have added the endocrine and metabolic also, so that it's not just confined to the ovaries itself. And it's not just the reproductive system, but the overall body that is getting affected.
Yes, we have to evaluate for her for overall body.
Okay, doctor, that was very informative and enlightening. So we have been getting a lot of questions around PCOS, and now we call PMOS. So I wanted to just go through some of the questions with you today, as we are already on this topic. So one of the questions our users have asked is, does PMOS mean that I will have difficulty getting pregnant? I'm 26 and I'm planning to start trying.
Okay. So 26 is a very appropriate age to conceive. Because see, I'll tell you, females have a biological clock. Okay. So best age for reproduction is 20 to 35 years. Okay. Between 20 to 35 years, their ovarian reserve is very good. So at this age, there will be less chances of aneuploidy, that is repeated abortions, genetically abnormal babies. So this is a very appropriate age. 20 to 35 years is a very appropriate age to conceive. They have good ovarian reserve. There is less chance of aneuploidy, that is genetic diseases in the babies. So very good. She has PCOS or PMOS. So she is asking whether this is going to be a problem for her. Yes. Okay. So I will tell you. See, I will not tell she does not have very good chance to conceive. She has good chance to conceive. She just needs a help. Yeah. She does need a help. Okay. This help can be done by herself also. She can try by herself. If there are now, this Premom has given so many options like ovulation prediction kits. Yes. She can go with ovulation prediction kits. Now she will tell me my cycles are irregular. How can I go for ovulation prediction kits? But the thing is, her cycle length of a cycle minus 17 days is the starting date to start the ovulation prediction kit. Whatever is the length of a cycle, suppose it is 45 days. You subtract that 45 days with 17 days. What day it gives, that is the day you will start ovulation prediction. Okay. So start it daily or twice a day till a very bright light comes. And then when the test and control are similar, it means the highest peak of LH surge, and she's ovulating. She can conceive in those days. So this is one method. Otherwise, also she can try like this for 2 to 3 months by herself. And then if it is not happening, then she can go to a doctor and get an ultrasound follicular scanning done, where they will tell the exact time of when the dominant follicle has appeared, 16 to 18 mm. And then they will tell her, okay, your ovulation is going to happen, and they can give her an LH, HCG trigger. Those days are again important for her. So I don't tell PCOS per se is going to be cause of her infertility. There is no infertility for her. She can conceive, but she will need a help. Definitely she will need a help. Okay. She can help herself with this knowledge of ovulation prediction kit, or she can take help of an expert. Okay. So you're saying that with PCOS or PMOS, what we call it now, so it is not difficult, or it is not leading to infertility, but with right amount of help and right knowledge and OPK testing, it is possible. It is still possible to get pregnant with PMOS. Okay. We have a next question. I have PMOS, but I'm not overweight. My doctor says my hormones are fine. Why do I still have symptoms? Okay. See, the hormones, these endocrines, I told you that hormones is a major cause of PMOS. And always it does not present. See, any disease does not present as it is there in textbook. They present variably. That is why clinical experience helps. So what we want to tell you is all the PMS or PCOS patients are not obese. Their BMI may be normal. Their hormones may be within the normal range, but they may be at the higher normal range. Okay, whatever is it, the obesity may not be there. She may be thin with normal hormonal levels, but still the hormones, the endocrines are playing their role. her stress and unseen stress. She doesn't even know her
Yeah.
job stress, her family stress, anything could be there, which will be subtle normal. Matlab they are sub hormonal levels,
Okay.
subtle levels. There be subtle levels. Example, the thyroid itself. The thyroid level, there will be subclinical hypothyroidism we call. It isn't present to you, but it is in the normal range. But still the patient has mood swings, obesity, so all like this. So in PMOS, even though her BMI is normal, even though her hormonal levels are normal, there may be subtle hyperandrogenism. There is rise in LH level, which is higher normal level. So she will think it is normal, but it is a higher normal level, a higher side of normality. It is always a range.
Okay.
With less level also, it may present to the patient. So there may not be always polycystic in the ovary. Actually, it is not cyst. The misnomer is that they tell no polycystic ovarian syndrome. It is a misnomer. They are not cysts. They are antral follicles, smaller size of follicles. They are antral follicles which produce more of androgens. That is androgens. That is testosterone. So that is the reason of presenting with hirsutism. So she may have any subtle presentation of hirsutism or irregular cycles or difficulty to conceive. So even if it is not present, textbook definitions, textbook classifications are not there, but she may have mood swings only maybe her presentation. In unable to conceive maybe her presentation. She may present it clinically. Now all I wanted to tell you is treatment. See, treatment is there is no specific single drug for PCOS or PMOS.
Yeah.
Okay. What is the major first line of treatment of PCOS is PMOS is lifestyle modification. So all I want to tell you is get up and walk. Walk in the mornings, evenings, between your work. So lifestyle modification is the first line of treatment for PMOS. We want people to be healthy. So one lifestyle modification, that is exercise, 10,000 steps, then reducing the stress with yoga. It is very important. See, we don't know the stress what we have. We don't know what is causing stress to anybody, our work, our life. So all I want you is to maintain, reduce your stress levels by yoga, meditation. Okay, then lifestyle modification, that is walking, avoid junk foods, have healthy green leafy vegetables and fruits. That is the way of longevity also. Right. So lifestyle modification or reducing the stress is the first line of treatment. Apart from that, because it is metabolic and polyendocrine problems, we will search. Your part of job is lifestyle modification and reducing the stress with yoga and all. When you come to us as a doctors, we will do work on your hormone levels. If your thyroid is low, we will treat it. If your insulin resistance is high, again that will be helped by lifestyle modification. Your nowadays for obesity, apart from lifestyle modification, you do have drugs for obesity, semaglutide, tirzepatide. So they are helping. Plus, they also tell you about lifestyle modification, that is exercise. So if exercise is the first treatment for everything. So lifestyle modification, yoga, stress relieving, then weight reduction with even medical help. Apart from that, we will treat you symptomatically for symptomatic problems, such as if you have problems with anovulation, we will treat you for fertility with ovulation prediction kits. You can try yourself if you're not able to come to the hospital. Then we can treat you for infertility. For hirsutism, we have clinical methods, we have chemical peelings, we have laser therapy, we have drugs to reduce hirsutism, we have drugs to reduce acne, avoid oily foods, keep your oil-free environment. So we have drugs to reduce acne. So all the symptoms have their treatment, like their irregular cycles has treatment, your acne and hirsutism has treatment. So it is symptomatic treatment, but the first treatment is lifestyle modification and weight reduction and yoga, stress relief. There's no one single drug for treatment of PMOS because its name only tells that it is polyendocrine problem.
Yeah.
Polyendocrine metabolic syndrome. And we can predict that this female can go for diabetes mellitus. She is having risk for cardiovascular diseases. She has risks for endocrine endometrial cancer, that is CA endometrium, that is carcinoma endometrium, carcinoma uterus.
Okay.
Chronic anovulation, that is not getting cycles for more than 3 months. We should not allow the cycles not to have more than 3 months. We should not let the irregularity be for more than 90 days. If the cycles are prolonging for more than 90 days, more than 3 months, 4 months, 6 months, you should not allow it to prolong for more than 3 months. Okay. It should not be amenorrhea of 4 months, 6 months. It should not be there. Don't leave it for that days. You have to get yourself treated if you have amenorrhea of 3 months, more than 3 months. Don't let it go more than 90 days. We will give you some hormone so that you will have bleeding. Okay. If it goes for more than 3 months, there is high risk for uterine cancer, cancer of the uterus, hyperplasia. So we can predict so many things you will be going ahead. You may have to face if you don't control now itself. So everything can be controlled and everything can be managed when seen before time, well ahead of time. So we can predict for a patient going into diabetes mellitus. We can predict she going to have cardiovascular diseases like heart attacks, angina. Okay, then we can predict her to have endometrial cancer. So we can predict this and treat this, and treatment you all know when it is at the basic step, lesser step, that is smaller step, PCOS or PMOS patients are more prone to all these diseases. Dyslipidemia, that is lipid levels in the body changes as the obesity increases. So all can be controlled when it is at a smaller stage. This is all I wanted to tell you.
Okay.
Thank you, Premom. It's a privilege to get associated with Premom Healthcare, which is taking care of so many basic needs of so many women who are sitting at home and not able to come for consultation because of their stress, because of their heavy routine. Yeah, it is helping a lot of women out there to reach with one mobile or one internet connection. Nice, proud to be a part of Premom. Thank you.
Thank you. Thank you so much. That means a lot coming from you. At Premom, our mission is to help every woman truly understand their body. And with easy at home OPK test, that is what our mission is, that they can do the testing right at their home with expert guidance, BBT, cervical mucus, everything combined, so that they get a phygital experience that we call, that is the best of physical health tools as well as the digital knowledge, all in one place. Whether it's PMOS, fertility, hormones, or just understanding a cycle, we are going to keep bringing these conversations with the finest experts from across India. So if this helped you, subscribe to our channel and share this with a woman in your life who wants to hear this, who needs to hear this. And stay tuned, because every woman deserves to know and deserves to know the clarity about her own health. Thank you.